this machine is a mechanical thrombectomy device, as you guys know, right? The indications for this over an export catheter would be a large diameter vessel with a very heavy thrombus burden. Okay, typically you're not going to see this used unless your vessel's probably in the 4.5 to 5.0 range. Okay, otherwise it's much safer and easier just to use the regular export. One thing to consider before they perform angiojet is always ask the interventionalist if you'd like to put a pacing wire in beforehand. Regardless of which coronary you're intervening on, you can have pretty profound bradycardia and heart block. Nobody really understands what the exact mechanism is for that. There's a lot of theories, but nobody knows for sure why it happens. One of the thoughts was that as you actually perform the thrombectomy, you lyse the red blood cells and adenosine gets released into the bloodstream. So that's one theory, but it's not been proven. Okay? But just know to be aware of it. I know the last couple of times they've used this, the doctor elected not to put a pacing wire in. Patients did become bradycardic. It's usually self-limiting them, okay? Just like it would be when you give adenosine for an FFR, for example. Okay, you just have to be aware for it, pay attention to it, and treat it as needed. Okay. This is a very simple machine. It's pretty much fully automated. It has an operator pedal, just like we have for the rotoblader. Okay, so you bring this machine into the room, you're going to just hand this pedal off to the physician under the table. Okay. You're going to take a liter bag of saline, and you're going to mix 5,000 units of heparin. That should go on the reference card. Okay. Next thing we're going to do is we're going to turn on the machine. Simple power button right here. And we're going to open the catheter and hand it off to the scrub person. This is a little wet, so it's not sealed up, but this comes out.
Where is it kept in the...
Show the box.
We have them on the shelf, kind of where the roto stuff is. I believe it's on the bottom.
Show the box. Lovely.
There are many different sizes of these catheters. This is the only one we stock.
Okay.
Now the packaging is opened up very much like the roto-burr would be opened. Okay, you just have to be careful because it is easy to contaminate this guy. It's a little bulky, so you're just going to peel the package back like this, and the scrub person is going to remove the packaging like so. You're going to lay this flat on your table. You can pull this off. And again, this has already been used many times, so it's going to be a lot neater coming out of the package. But you're carefully just going to lift the whole thing out like so. Okay. The older versions of this, there was actually two components. There was the tubing and the waste set, and the catheter. They came separate. Okay, this is all contained in one unit now, so there's very little that you need to do with it. Once you see the power on the machine has been turned on, this door will open automatically. Okay. And it's going to tell you on the screen exactly what you need to do. So the first prompt that we get is insert pump close drawer. So the scrub person is going to hand this off to the circulator. Okay, so whoever wants to be the circulator, you're going to grab that and you're going to place that in there just like so. Make sure it's all the way in. And those don't need to be in any particular place, just hang in there. Okay.
Yeah.
Now you're going to close the door. So in order to close the door, it's a simple button. I don't know if you caught that, it said catheter spiral flex. So this machine automatically detects which catheter is there. Again, there are different catheters. This is the only one we're going to be using in the cath lab. Okay, so there are different French sizes, good for different size vessels and whatnot, but again, this is all we have for coronary industry. Next message that comes up on the screen is, it should be, connect saline supply. So I think it's given us the error message because it's detected that there's already saline in here. Normally, if this is a dry setup, it's going to tell you to connect saline. So go ahead and do that, Jim. There's a sensor in here. That's already sensing that there's fluid there. Now, I don't know if you caught that, but you see the fluid automatically flowed right in there. See how that filled that right in? Okay. So the next thing it's going to tell us to do is submerge catheter tip in saline and prime catheter for 15 seconds. So we're going to carefully remove this from the hoop, just like everything else that we use. Again, you don't want to have small loops here. You want one big loop. This catheter is very, very easy to kink. Just like an OCT catheter, if you kink this catheter, it will not work. In fact, this catheter has already been used so many times and it's already kinked that it may not even perch. I had some issues with it yesterday, but we did get it to work. There's a stylet at the end of this. This is also a monorail system, like most of our balloons and stents. We're just going to carefully remove that stylet. And it's telling us to purge the catheter. So as the scrub person, you have a couple of ways that you can do this. My advice would be to just take your small kidney basin, fill it up with fluid. You're going to submerge this catheter in there, and then you're just going to step on the pedal. There's a timer counting down there for 15 seconds. If we're lucky, we'll finish the purge. Okay, so completely just going to tell me to take my prop. Next step is, actually it gave me a volume there because I had actually stepped on it longer. But at this point, once we've purged, it's ready to advance into the patient. If there's any error messages, it would show up there. I'm going to show you what happens if you don't submerge this in water. You can kind of come close with your camera there. This is the reason why we submerge this in water when we purge. Okay? Especially if this has already been used, it goes back into the body. If you step on this thing and it's not in water, you're going to be spraying blood everywhere. Okay? The way that this catheter works, it works on a principle called the Venturi effect. So you've all had a shower, and then sometimes you feel like the shower curtain gets sucked into the water, right?
Mm-hmm.
We've all had that happen. And what happens is that water coming down rapidly actually creates a bit of a vacuum, and it sucks that curtain in. This catheter works on the same principle. So what this machine is doing, you can appreciate that that's a very, very small lumen within there. This thing is pushing saline through there at very high pressure, okay? What is happening is the saline is traveling down the catheter and then coming back up the catheter. So it's kind of like a single lumen connected to another lumen, right? So that it goes down the inner shaft, and then there's an outer shaft around that, which brings the fluid back. And there are some tiny little holes, well, you saw it was coming out of the holes a minute ago, and that velocity of fluid traveling back up the catheter is what sucks the clot into those little holes, okay? The reps used to come in with a jar of jam, and they'd have jam in there, and they just basically stick the catheter in, and it would actually suck the jam right into the catheter. Yeah. But that's all there is to it, okay? Again, this is a monorail system, so you're going to fix the wire for the doctor until they've got control of it, and then they're going to pretty much do it.
So how often do they do this? Like,
It's very rare. We've only used it.
no, I mean,
Oh.
like they'll do it one time. Will they clean the catheter and try it again if they don't have the
They may.
result? Yeah.
It usually only takes one pass, maybe two
Okay.
passes. I
Okay.
wouldn't anticipate much more than that. And then they're going to image the coronary. If they're happy that they've got enough of the thrombus out, then they'll go ahead and proceed with the rest of the intervention.
And you should be seeing all the stuff coming out.
Exactly. You're going to see blood and clot flow back into that bag. That's it. When we're finished with this, you're just going to go ahead and open. You're going to remove all of this. That will all just get disposed as normal. And I'm not sure if this one even comes apart or not. I don't think it does. It's all a fixed system. So this really, you could try to get this into the sharps. I don't know how easy it's going to be for you to do that. Again, you can kind of curl it up as best you can and drop it in, or keep it in your drink.
Great.
Really, I mean, you can get rid of this, but this is all together, so it's going to be kind of
Very
hard to
simple.
dispose of. So again, to remove it, you're just going to pull that out, and you're going to take this. Obviously, not going to spring that.